And today is our 1031st day. So, okay, 31st day. So we started our journey. Now we reached 1031st day, and many doctors, lovers joined with us. Very happy to be here. Now also we are continuing our journey. Today's our guest is Dr. PRITI Desai. I will make her as a host first, then Dr. PRITI Desai has joined. Okay. Okay, doctor. So today's our guest is Dr. PRITI Desai. She's worked as a homeopathic physician in Indian Railway Hospital and also initiated homeopathic clinic in income tax. Both are in Baroda, and she worked in Qatar. And before going Qatar, she worked 20 years in India, and she food as a medicine in chronic disease by the Institute of Functional Medicine. Today's our subject is desire and aversion, related causes and deficiencies. And I'm welcoming Dr. PRITI Desai for our session. Thank you so much. Please. Madam, please unmute yourself and you can. Okay.
Hello, everyone.
Yes, we can hear. You can.
1 minute. Hello, everyone. First of all, Eid Mubarak to everyone. And I want to share my... Can you hear me?
Yes, yes.
Yeah.
Oh, you have joined from the 2 devices, right?
Okay. So I'll start with my PowerPoint presentation. Here. Can you see?
No, not yet.
It's okay. I'll go.
Share. Have you shared?
Yeah, I have shared. I don't know, I'm not getting that. I'll join again. Is it okay?
Yeah, you can.
Why this one is small? So, one.
Dr. Ajini, I think she changed the device. So please make this device co-host.
Okay.
Yes. I think she is using second device now. That's also.
But she has not joined, right? That it
Anyway,
is from.
please
Okay.
make her co-host in that
Okay.
device also.
Thank you. But I think from the mobile, she is joined with.
Yes, please make her co-host in that device. Otherwise, she can't share. Yes. Dr. PRITI Desai,
Yeah.
what happened?
Can you hear me?
Yes,
of
sir.
course.
Okay. I don't know what happened to my PowerPoint things. It's not going.
Don't worry, you can present without screen sharing. No problem.
Okay. Okay.
Yes, please proceed. Yes. You are muted. You are muted. Please unmute. Yeah.
Okay.
Yes, please proceed.
Okay. So this is the first my introduction about my topic is I don't know why this comes. My presentation is not coming.
Madam, have you clicked the share button?
Yeah, I have shared button. I don't know what happened.
After clicking, we can above in your screen. You can again. You have to share. Have you done it?
Yeah, I did that.
Then I don't know what happened. Maybe.
Okay.
Okay.
What is happening? I don't know in my computer.
I think you can depend now the natural computer, your brain. Go without screen sharing, please.
I'm not able to share these things. I don't know what happened to this. Okay.
No problem. Don't worry about it.
Okay, I will go with my writing. So the various desire for an aversion to various substances are as a rule general symptoms, and for they depends upon some deep need in a body as a whole. And if it is outstanding and definite, must always in high rank. This is a quotation by Dr. Robert Miller. He born in 1862 in Glasgow. So usually the doctors are always whenever we take a case, we usually do that physical journal desire and aversion. We just neglect it and we just take it in a totality for selecting our medicines, right? And we usually we differentiate with those symptoms. So being a homeopath, we use desire aversion as a physical journal, and we give little importance to these symptoms just to select remedy and differentiate from others. So we must go beyond this and to be curious why body demands particular food. And in today's lifestyle, food habits have big role to play as a maintaining cause for most of the disorders. So our body tells us what we need or what is deficient by desire, craving, aversion, and hunger. So basically, what is desire and what is craving? What is a minute difference between that? So craving is a typical psychological and sensory demand, and it can arouse by picture, smell, memory of food, or emotional cocktail. Can also drive craving. It is also give pleasure feeling. It is regulated by hippocampus in brain. So most of the time it's a very minute difference between craving and aversion. And even minute difference between desire and craving, sorry. And desire is physiological demand which body is needing. Craving is sensory demands. Well, desire is physiological demand. This is very natural reaction to need of nourishment and nutrition. So it is regulated by hypothalamus, amygdala, and hormones, especially dopamine and serotonin. So very thin line of differentiation. And to understand this craving and desire, and if we see that our master Dr. Kent has kept desire and aversion, the chapter in stomach, not in mouth, right? It's not the glands of our taste buds of mouth is deciding what we need, but for craving, the desire and desire and craving is different with this type of things, that the craving is sensory and desire is body need, physiological body need. Now, if we talk about aversion, it's a very strong dislikes for particular food items, like because of sight, smell, or taste of the food causes dislikes or nauseous feeling. Sometimes previously enjoyed food now becomes disliked item, and this especially occurs during hormonal changes, as in pregnant woman. Person with a mental disorder condition, and in fussy children also, in some pregnant women, some desires which are sometimes food which is very liking for the person, and then it suddenly becomes dislike. So sometimes in training during childhood, mother don't like some food, she don't give to the children also sometimes. So this type of indirect even learning also occurs from the child, that I don't like this food and that food. So if some people avoid some food, if the food is replaced by some other nutrients, then it is okay. So aversion is not that much remarkable than the desire and aversion, the desire and craving. So if I go for organ and in aphorism, aphorism 259 to 263 is observed by our master, where he is saying about diet and regime during treatment. So the slight hindrance that gratification of this desire within moderate bounds could oppose to the radical removal of disease. So desire of patient affected by an acute disease with the regards to food and drink is certainly chiefly for things that gives palliative relief. So I'm not talking here about acute desire during acute problem, like during fever, one person needs some tasty food, or during upper respiratory tract infection, people want some spicy food. That is a temporary desire and temporary palliative effect. While if you desire for in a chronic cases, desire is very important in our selection of medicine. So I want to say here that Hahnemann briefly discussed and considered food habits, nutrition, and type of food which can support or create hindrance to homeopathic treatment regime. So aphorism 259 to 263 is very important for diet and regime. Here I would like to describe main 5 taste, desires, and related potential deficiency of nutrients. Also, it indicates underlying disorders. Now, in day-to-day life, we are eating so much outside food or partying everywhere, and we are not concentrating on nutrient-based foods than the other party foods. We always nowadays if even though we give a proper food or proper medicine, still we are not getting proper nutrients, and we are not getting proper cure. So I have divided 5 tastes, whatever food is there, but the dominant taste I have decided. Whatever desire for food is different, but then dominant taste I have decided why this craving occurs, like sour, sweet, salty, spicy, and bitter food. So first of all, I'll take sweet. Now, craving for sweet indicates low level of magnesium and high adrenaline hormones, that is stress hormones. So actually, magnesium helps to regulate insulin, and it is also a muscle relaxant. And our adrenaline causes increase in blood sugar level to fight and flight mechanism, where during stressful condition where the sugar is very important to give energy. So both the things where low level of magnesium and high adrenaline hormones lead us to crave sweet. This is very important observation. So sometimes some patient comes and, oh, I can't reduce my weight because I crave so much sweet. And I ask, have you ate some leafy vegetable within these 2 days? Or what you have in morning, in lunch, or what you have in dinner? Then they says, no, I had some outside pizza, pasta, and all this. It doesn't contain green leafy vegetable, where we get magnesium from leafy vegetables, green leafy vegetables. So whatever green leaf is there, because of magnesium, the leaf color is green. So this is all interrelated. So please tell your patient to eat proper green salads and leafy vegetable, especially when they have sugar craving. So this is related to desire and aversion, where I am saying, and it definitely reduces sweet craving. And main source of magnesium is leafy green vegetable salads, which reduce sweet craving. We can also use biochemic tissue remedies, which contains magnesium. And we have neglected so much that Sussler's all tissue remedies, which is really supplement to our homeopathic medicines. So I always prefer biochemic tissue remedies, and it gives a very good results in my patient. Here in sweet craving, I will also include chocolate, starch, carb craving also. And you know that dark chocolate contains magnesium and bromine, which also helps in reducing level of stress hormones. It boosts up dopamine and serotonin. These are also pleasure hormones. So sometimes, when there is a party, we are in a happy mood, we always end up with the desserts and sweets. These all are increasing our dopamine and serotonin hormone. And it again and again craves sweet things, and it gives us in our memory that whenever you are in a low mood, you need some sweet, which gives you a pleasure. So it's again related to deficiency of magnesium and hormones. Please note this. Now again, I will go to the salt craving. Why people crave salt, like chips and savory foods? Because it is electrolyte imbalance and deficiencies. And in electrolyte, salt craving is not only an sodium chloride. Salt means electrolytes, and it contains all calcium, magnesium, potassium, chloride, and sodium. Now all 5 elements are needed, minerals especially are needed in salt. So craving for salt mostly indicates sodium and potassium imbalance, basically, because sodium and potassium works in a cell like a pump. If sodium is increased, then magnesium is decreased, and if magnesium is increased, then sodium is decreased. Potassium. So sodium and potassium are working like a pump. So if sodium increases in a cell, then fluid retention occurs. And that's why so much fluid retention leads to the hypertension also, and renal problem also. So salt craving also indicates iodine deficiency and calcium deficiency, because from sodium chloride, chloride is needed for making hydrochloric acid in our stomach. Now, if HCl is deficient, then so many our vitamins and minerals are not absorbed in stomach, and it is protein is not properly digested, and it goes to the deficiencies. So treatment wise, biochemical medicine, additional nutrient supplements should be used to support this electrolyte balance. Sometimes, in hypertensive patient, diuretics also, if our patient is purely on homeopathy, it's a different thing, because our medicine are capable of balancing all the fluid retention and everything, and all nutrient deficiencies also. But if patient is parallelly taking some diuretic medicine for hypertension, then we have to give electrolytes to balance, to supplement potassium. And different type of salt gives a different minerals. We are using that rock salt, Himalayan salt, sea salt, iodide salt. All are having different, like Sindha salt in fasting also people are using Sindha salt. That contains potassium chloride, not sodium chloride. So, and Himalayan salt takes so many minerals. So we have to use different salt in our patient to get a faster relief. I'm talking all this, I'm not talking in behalf of homeopathic medicine, but I'm talking with homeopathy medicine, we should consider all this desire and aversion in terms of fulfill our all deficient patient. We don't go beyond that desire and aversion. That habit we have to develop now. So now sour food. These main 5 tastes I am talking. Sour food is craving for sour food indicates low level of choline in liver, low level of bile and fatty liver. It also indicates fatty liver. So this indicates low level of acid in stomach also, and which leads to indigestion due to disturbed metabolism of fat and protein both. So many patient craves now when I have developed these things, and any patient comes with the, oh, I crave sour, then immediately I think about the liver, that there is something wrong in liver. So line of treatment here also I am suggesting biochemic number 25, which is very beneficial to my patient. So that's why I'm always in with this desire aversion, I am also combining biochemic medicines as a supplement. Still we need so much research in biochemic, because there is no biochemic version of sulfur, cobalt, copper, zinc. We need that also in biochemic. Now spices. Craving for spices happens mainly due to hormonal changes during pregnancy. There is a hormonal change specifically in pregnancy. Chronic stress, lack of thermoregulator, even sometimes in hot weather, people eat more spice to regulate their sweating, and then they get thermal regulation. Sometimes in congestion or inflammatory condition also, people take spicy food. Fifth is bitter craving. Now bitter craving is very rare craving. Very few people craves bitter food. So, but main bitter foods are helping us to detox liver. So if some people craves bitter, again think about liver, right? Now a particular food desire, for example, some people craves alcohol. Yesterday only we had that alcohol session. So some people craves alcohol. It indicates B1 deficiency, because alcohol reduce B complex with mostly water soluble vitamins. So B1 deficiency indicates and means an alcohol craving, B1 deficiency it indicates. Also vitamin C and D3 also. So if we fulfill B1, and there is so many things which is the alcohol, we can reduce the craving of alcohol by supplement of all these things. Amino acids are also there. There is a particular regime in de-addiction center where they give this type of replaces all the vitamins and amino acids to those alcoholic withdrawal symptoms. Now, if we go for a particular foods, for example, bread, it's again a carbohydrate, and it also indicates about low thyroid and low iodine. There is a references is also there. Unfortunately, my all slides are not working. I don't know. Then there is ice and ice cream. It also indicates low iron and low zinc. So some people, anemic people, most of the time craves for ice. It gives a temporary stimulation. It increases our circulation also. It gives just temporary well-being for anemic patient. Then fat and cheese and all fatty food I include in fat and cheese craving, which again indicates low bile, low level of fat soluble vitamins. So if we give fat soluble vitamin to those patients, they will not crave cheese or fat. And fat is actually in some amount is necessary for liver because it stimulates bile production. So we have to eat some fat, healthy saturated fat like ghee, cow's ghee. So it gives us a very nice metabolic and plus it also absorbs all our vitamin, which is fat soluble. It during digestion, it absorbs it helps us to absorb fat soluble vitamins. Then I will go for pickles. Now pickles are fermented food. So when there is a low level of B12 deficiency, B12 deficiency always gives us craving for pickles, most of the patient. And because it is a fermented food, and all fermented food contains B12. But it should be in a raw form. It should not be steamed because it is a water soluble. So this is very important observation. If we consider fruits, it is always antioxidant and low potassium. It indicates low potassium. Fruit also, all fruits contains high potassium. I have observed in hypertensive patient that most of the doctor says, okay, take low sodium food, but they never say about high potassium. Our everyday requirement of potassium is 4700 milligram. And if we eat one banana, we are getting only 326 milligram. So how many banana we have to eat, or how many tomatoes we have to eat? So it is a daily requirement of potassium, 4700 milligram. So I give advice to my patient, rather than reducing salt is required 2500 milligram per day, but potassium requirement is 4700 milligram. So this is very important thing where no one is saying that please increase your potassium rather than reducing salt. Potassium is again a muscle relaxant, and it also relaxes arterial muscles. So it is very important ingredient for reducing hypertension. It gives a nice sleep also. Potassium and magnesium are relaxant element. And sometimes crunchy and salty craving is also there. Some children are always on chips and salty foods. They are always electrolyte imbalance. Most of the people are filling their stomach with the junk food. And these are always electrolyte imbalance, nutrient deficient. Sometimes meat craving is also a low iron. Some organ food is also indicating low iron. Everyone knows that pica in children children eats mud and all these things and soils, and then these are all mineral deficiencies. So like calcium, zinc, iron. So best medicine for that pica is root vegetables like beetroots, carrots. All these helps to get their minerals again in their body. So all these are my observation and study for what leads to what deficiency. And if we add this with our homeopathic medicine, it will definitely helps us to faster our cure. It's not only that our medicine in nowadays, in present lifestyle, only medicine is not working. We have to concentrate on our diet and food supplements. So I will give one case. I will discuss one of my patient who came for Mrs. G, age 48 years. She came for complaint of arthritis and obesity, and she desired raw vegetables. When she's chopping her, while cooking, she chops a vegetable and she eats half the vegetable. She eats cauliflower, cabbage, bhindi even. She is eating. And I surprised that how come? And then when she saw her investigation, there was a fatty liver. And how it is connected? What is fatty liver connected to the raw vegetable craving? Because raw vegetable contains sulfur, sulfonamide. And our fatty liver is the sulfonamide is a #1 detoxifying agent. So our liver is craving sulfur. Of course, I have not given patient sulfur as a homeopathic medicine because she was a chili patient and I gave her calcarea carb. But this raw vegetable, the sulfur, and it related to the fatty liver. So I told her to eat more and more salads, and these all cauliflower, all vegetables every day. Cauliflower or cabbage or bhindi, any vegetable of 3-4 bowl every day. And it helped her a lot. It reduced her fatty liver. So these are my experiences. One of my patient with essential hypertension, he was craving salt, of course. And his investigation reports were not so much particular. Every reports were normal. He was a young person at 40 age. And I gave him potassium to take high potassium food like avocado, banana, then tomatoes. There is so many potassium. If you will see the whole list of potassium, and it helped him a lot. He got a very good sleep with parallel to homeopathic medicine. And I observed that my suggestion of food gives me benefit to faster the cure with homeopathic medicine. Another patient of I gave him, he had a ringworms, and I gave him vitamin D as a supplement. In skin patient, I'm always giving vitamin D because it helps a lot in skin or exposure to the sun, especially skin patient, and coconut oil rubbing. So, and sometimes I also, as I have done IFPH, and that Institute of Functional Medicine course, where there is a elimination diet is also explained, where elimination of some kind of allergic diet like gluten food, then milk, then other few list of allergic diet are there. If we remove that sources during our treatment, it helps faster relief. So overall, these are my just short observation. I'm still studying in these things. I'm just suggesting you people also please observe all this desire and aversion related to your patient's complaint, and please suggest them food. It will definitely help you to get the faster relief. So this is my very short explanation on desire, aversion, and deficiencies. You can ask me any question is there.
Thank you, Dr. Preeti Desai. Actually, it was a wonderful presentation. Normally, we all have desires, but we don't know the cause of it. And sometimes we may notice that before I was craving for that, now I don't have.
Yeah, yeah.
And for this ice and ice creams, mostly because of iron. That I think everyone knows, but
Yes.
rest
Even
others.
pica, everyone knows pica also.
Yeah. But lot of the things that you have told today is very useful for everyone. Thank you so much. And Dr. Hariharan has raised his hand. Dr. Hariharan, please unmute yourself and.
Doctor, okay, thank you very much for your class, very nice. But
Yeah.
doctor, see one thing, you said that like raw foods, Silesia is one of the best medicines.
Yeah, there is a list of medicine. I'm not discussing any medicine. I just want to correlate. If some patient is asking raw food or this type of thing, just relate yourself with the liver condition. Sometimes patient don't say. Sometimes accidental investigation comes.
Okay, doctor, I can say a lot of things,
Yeah.
but the time in the see mixtures of food disagree. You said desire and aversion, craving and desire, but certain patients desire things, but
Yeah.
it didn't tolerate.
Yes.
Such a food preference is also there. See, certain patients like fruits, but fruits disagree.
Yes.
That is if I say arsenicum and pulsatile is the medicine.
Yes. Yes. Because
But-
of toxicity in the body.
But why it is so?
Toxicity. Increased toxicity always aggravate the symptom.
Okay, the patient craves a desire for that.
Yeah.
But
Yes.
even then,
that is also important whether it is acute condition or chronic condition.
that is also important.
Yes.
I am saying about the chronic condition, not acute condition.
Mhm.
Likewise, certain patients craves egg, but it disagree.
Yes. Yes.
See, like certain patients like see a boiled eggs.
Now
And
I will suggest here one thing, that egg is a full normal balance food. Total balanced food is egg. Number one balanced food, because it contains protein, fat. Egg yolk contains all A, D, E, K vitamins plus choline. Choline is a liver enzyme which helps in 500 type of metabolism, also in hormonal metabolism also. Liver balance is thyroid hormone also and estrogen hormone also. So it is very important element.
okay, very correct.
And one more thing, where you says it disagree. Disagree in what form? Disagree means in stomach it disagree, patient vomits out.
See, stomach disagrees.
Stomach disagrees. Now, sometimes some food is not digested in stomach because of low HCl.
Correct. Maybe that.
Yeah.
Maybe that.
So both thing is to be considered together, and we have to supplement in that.
Okay, very good. See, I am astonishing that certain patient like olive oil.
Olive oil, yeah.
Have you heard
Olive
about
oil I will consider as a fatty food, as a fat.
See, like patients, like olive oil patients are arsenicum and lycopodium. So, arsenicum and lycopodium patients like olive oil.
Yeah, yeah.
See, this way I can say a lot of things. I can say a lot of.
So now you please, sir, you please continue your observation and correlate all the diseases and why it desires these things. Please
Okay,
do
I am
that.
correlating. Now I am correlating like that. See,
Yeah.
another thing I am seeing is that
Hmm.
suppose if you are suppressing one taste, suppose a patient is having craving for alcohol.
Alcohol.
Craving for alcohol. See, by counseling, and that craving is if suppressed, another craving will arise. That I have seen.
Yes, which type of related?
See, sometimes that patient may craves for sweets.
So see,
Like
there is so many minerals working together. All see, our body is biochemic identity. So many biochemical equation is going on in our body, and it
Okay.
requires at a time so many elements. It's not that one element is gone, so another is not required. At a time, same time, so many elements are required.
Okay, very correct. Okay, you have done so much research in that.
No, not it's not a kind of research, sir. It is the training which I have taken as a Institute of Functional Medicine, where I am correlating that with the homeopathy.
Okay,
And
you're
still,
correlating.
yeah,
Okay.
I'm correlating that because those people are allopathics.
Okay, certain patients like Easters, calcium contained Easters, certain patients craves. Easters means the crab like that.
Seafood. I will consider it as a seafood.
Crab like food because that shows the calcium deficiency.
What deficiency?
Calcium deficiency.
Calcium deficiency. One more deficiency, that is iodine deficiency in that. Seafood is very rich in iodine. And it gives iodine deficiency. It supplements iodine also. Not only calcium.
See,
and one more thing, calcium will absorb only if stomach acid is proper in a body.
Very correct. Like this.
So many times people take calcium, but it is not going to the bone, but instead it settles in the arteries. Okay.
Certain patients like milk, but
yes,
sometimes it may not tolerate.
Yes.
That your observation is correct.
Yes. Yes.
Tolerating by stomach or by body itself.
Yeah.
Correct. Yes. See, a lot of other doctors are raising the hand. So I am stopping.
Nowadays, what? Okay. Any other question is there?
No, see any other doctors are raising.
Thank you, Dr. Hariharan. Now, Dr. Salim Kumar, you can. Can you unmute yourself? Dr. Salim Kumar, where are you? No.
I will give all my slides in WhatsApp. I will provide my all slides. Okay.
Okay, doctor, the slide is very important. Yes. In such a process.
I don't know what happened today. Just now, in my computer, problem has occurred.
It is our bad fortune.
I will definitely give it in on the WhatsApp. Definitely.
Okay, doctor.
And we can have a single disease also, and with that the food correlation we can take.
Okay, that. Very correct.
Oh, sorry. Dr. Salim Kumar, sorry. Now, Dr. Danish, can you unmute Dr. Salim Kumar? Now I'm not the host. Or anyone else, those who are co-hosts.
Okay.
Hello,
madam, your class was nice. Class is very nice. One question is, in how many ways a vegetarian can compensate B12 deficiency?
B12 deficiency by vegetarian. Okay. In vegetarian cannot cover their B12 deficiency because no vegetable directly have, only pickles is having, fermented food is having B12 and mushrooms. Yeah.
Mushrooms.
Yeah. So they can eat pickles or mushroom, but in raw form, because B12 is water soluble. And I have done pickle, whole study of pickles, which pickle should be eaten. Which pickle is good for which disease. We can take that also.
Which pickle?
Yes.
Which pickle? Usually mouth ulcer, etc. For which pickle is good?
For?
Which pickle is good for mouth ulcer, etc.
Lemon pickle.
Oh.
And B12 is mango pickle is also good. Yes.
Usually we are avoiding it.
No. Please don't avoid pickles. Please, I will give you another session for pickles. A long session for pickles. So many different, and our India makes so many pickles. I'm so happy with that. And it contains B12. And never give away your old pickle to any other person. My mother always used to give old pickle, and she makes new pickle, old pickle to servant. Please don't give old pickle to servant, because it is full of B12 and other nutrients also, plus electrolytes, plus minerals. So many things in pickles.
Okay, madam. It is
Please don't
very
throw old pickle or don't give
My
it to
question
others.
is, which are the other fermented food beside this pickle?
Mostly this cabbage, fermented sauerkraut, we say. Kimchi is also fermented food, but these are our European food.
Yeah.
Our Indian food doesn't, we don't know how to make sauerkraut, but you can see in the videos and everywhere that those are very good. I give all my estrogen dominating patient cabbage. Cabbage is very good. It contains sulfonamide. It reduces fatty liver. It detox fat liver, and it helps to regulate estrogen.
One additional question, because you mean the lemon pickle, it is with chili powder or without chili powder? With some,
that depends on your taste. That depends on your taste. But please use whole lemon, not inside part. But always, whenever you are taking lemon juice, even no vitamin C is supplemented with that. But lemon skin is very important. So whole lemon pickle should be done. It's not like only part.
Okay.
Whole lemon, you have to crush whole lemon in a, if you want to drink a juice of lemon, vitamin C, properly vitamin C, then you have to crush whole lemon and drink it.
Very wonderful information. Okay.
Dr. Ahmed Hassan. Thank you, Dr. Salim Kumar. Now, Dr. Ahmed Hassan.
Thank you, madam. Madam, can about diet, how to maintain the hydrochloric acid of stomach, as you told, it causes so many diseases.
Yes,
less
because
absorption.
Yeah, I will definitely explain this. HCl reduces according to our age. When age is we get older, our HCl production reduces. Sometimes in stress also it reduces. Sometimes we take low sodium diet and sodium chloride is not gone, so it reduces. There is two ways to increase our HCl. One is with apple cider vinegar, that is acetic acid. Second is lemon juice. But we should take whole lemon, not as just crushing it. Means by crushing a lemon, whole lemon in a mixture and then drink it. By these two ways, before lunch or before dinner, before any meal, if we take 1 teaspoon of apple cider vinegar in half glass of water before food, we can go to 2 spoons also. Especially our old patient, because acid is required to absorb vitamin B, C, calcium, and protein. All 4-5 things is important to get absorbed by acid only.
Thank you, Dr.
Thank you.
Hassan.
Thank you, madam. Thank you, madam.
Dr. Manoj.
Thank you, Dr. Adini. Nice presentation and important one. So whenever you are delivering such talks or sharing some views, we must stick to the principles of homeopathy, I think.
Yes.
Because we know that chronic disease, it was advised by Hahnemann, we must always restrict the use of organic acids.
Mm.
That means the buttermilk,
Yes.
then this vinegar.
Yes.
It should be interdicted. The word is used.
Yeah. Even some pickles are also made in vinegar.
It should be interdicted. So whenever you are using this lemon or lemonade or lemon pickles, and you are selecting a remedy, then not only remedy, but also sticking on the basics, that is the minimum dose.
Yes.
You should obey all these things. Then another thing is that when we're talking about this deficiency on the absorption on this contains this substance, that contains this substance, we must remember the topic SORA or the deficiency miasm.
Yes.
If the patient is affected these miasms, you cannot expect this vitamin B12 will be absorbed, then
Yeah.
will be absorbed.
Yes.
Another important thing is that without the presence of these certain chemical substances, we can create desires and aversions in healthy human being.
Yes.
So that is also should be considered.
So
That's why I am insisting that we should have our own view based upon homeopathy while we are trading through this path of these nutritional principles. Okay.
Yes. So actually, our homeopathy medicine is capable of balancing everything. But now the lifestyle has changed.
Then
You
what?
can't expect so
Then
many
what?
things.
Then what? We can see a lot of our doctors, young doctors, very complicated cases, treating with a single dose. Wonderful presentation you can witness.
Yes. But what happens that this type of supplements helps us to faster the cure.
Definitely, that is true. But that should not interdict the act of medicine. That's why I'm telling. Okay.
Yes. It will not because so many things, so many junk food is intervening the medicine instead of this. Some patients are seeing outside food, coffee is also coming in so many chocolate ice cream, or they mix up coffee also. So it is always
yes, doctor. Yes.
Inhibiting.
Yes. 2 more persons are waiting. Yes, please. Okay.
Yes.
Dr. Guru Kiran.
Yes, ma'am. Ma'am, what are the benefits of drinking ash god juice? Ash god.
Yeah. Ash god. I don't know its content, but it is alkaline actually. So sometimes some patients are having so much. People feel that they are having acidity, but sometimes there is another wrong belief of acidity also, and burping or GAD symptoms. But usually this good juice is alkaline, so it helps little bit help or in digestion, in burning sensation.
But normally the people who are trying to reduce weight, they are drinking this.
It doesn't help. It doesn't help. Yeah, it doesn't help.
Many are saying that
main thing carbohydrate intake should be decreased. Yeah.
Okay, Dr. Danesh.
Good evening, Dr. PRITI DESAI.
Good evening.
Very good presentation once again.
I'm so sorry for not presenting in PPT. I'm so sorry.
No problem. We can share it as you told earlier. We can share it through our.
Yeah, I will definitely give all the slides.
Anyway, it's a very important subject you discuss here, and the reason why the patient desire this sweet, why this patient desire sour, and why this patient desire this bitter. And as you rightly point out, these are the things that is the reason why patient chooses the things in hurry. But as far as homeopathic doctors are concerned, we have to choose this as the craving, and then we will have to find a remedy accordingly.
Yes.
That will aid us to choose the right remedy in the shortest possible time also.
In totality, we have to keep desire and aversion in high rank.
Yes,
It
then
definitely helps to differentiate and select a medicine. But it
When-
again gives us another thinking idea.
definitely. Sometimes we can choose the right remedy even from the very craving itself, because when the person has some intense craving for
Yes.
eating such sour things, then we can choose a remedy from that group, and that will aid us. So that is what Dr. Harriman principle works with the homeopathy. Thank you for your excellent presentation for this session.
Thank you. Thank you giving me opportunity. And I'm so sorry for not presenting this PPT. I'll definitely share my slides, all slides in WhatsApp.
Thank you so much, madam. It was excellent, and it gives us very useful tips about the craving.
Well, Doctor, I think let me remember one thing regarding the use of the hash guard. When you are treating the patient with arsenic album, you should, because we know that the watermelon or the hydrogen constitution patients or fruit containing a lot of water definitely will aggravate when when the patient is treating with arsenic album. So according to the medicine and the disease also, it should be modified.
Yes, yes, yes.
When he suggested me to drink hashguard juice for reducing weight, I'm so lazy to make all those things. So
that is why Harriman always advises circumspection is the.
There's
okay.
one more suggestion to the pharmacist also. Please, please make some few more elements in Susla's biochemic medicines. We have only 4-5 minerals, but we need more minerals in biochemic form.
And some asked, can you once again what you lastly said, KP in the chat box, milk craving intolerance, ma'am, please tell once again.
What?
Milk craving and intolerance.
Oh, okay, okay.
Please, and we have only 2 minutes. In that, please.
Yes. So milk craving is basically definitely calcium deficiency. But intolerance is because of so much urea and everything is there in nowadays milk. It's not pure cow milk or pure, sometimes cow milk is digestible, but buffalo milk or other milk is not digestible. One more thing, there is definitely a lack of acid in stomach, which doesn't absorb calcium. So 2-3 things are there for milk intolerance. Some allergies are also there. So some high level of urea is there. So synthetic milk in all dairies, there is so much, so you don't get pure milk basically. So I am not preferring milk like you know, in nowadays cow are also given to produce more milk, they give estrogen. They give hormones to the cow also. So all this comes in milk. So many things are intolerable.
Thank you, madam. And now I'm inviting Abida Salam from Qatar for vote of thanks. Then we'll give to Dr. Shaila for moderating Malayalam session. Abida Salam is there?
Yeah. Hello, thank you, Dr. Preeti, for your wonderful presentation. It has given a detailed explanation regarding the cravings and aversions. It was quite informative. And thanks to all the participants who found their time and spared their valuable time for attending this session. Thank you all.